Hello and welcome to NewMouth's podcast. I'm Sarah, and every week we'll journey together through the intricate world of dentistry. From dispelling myths to exploring the latest in oral health, we've got a packed show for everyone. Ready to dive in? Let's go. Hi everyone, welcome back to NewMouth's podcast. Today we're diving into an important topic that affects many people without them even realizing it. Gum disease. I'm thrilled to be joined by Dr. Jake, a seasoned dentist with years of experience in oral health care. Thanks for joining us, Jake.
It's a pleasure to be here, Sarah. Thanks for having me.
So let's start with the basics. What exactly is gingivitis?
Gingivitis is essentially mild gum disease. It's where the gum tissue becomes inflamed. The good news is, if we catch it early, it's completely reversible with proper treatment.
That's reassuring to hear. What happens if gingivitis is left untreated?
If ignored, gingivitis can progress into periodontal disease. This is a much more severe form of gum disease that can cause permanent damage to the gums and bones, and it often requires surgical intervention.
Wow, so early detection really is key. Can you tell us more about what causes gingivitis?
Sure, the primary culprit is plaque, a sticky film of bacteria that forms on your teeth. The bacteria in the plaque irritate and inflame the gums, leading to gingivitis. Several factors can increase the risk of plaque buildup, like smoking, poor oral hygiene, stress, hormonal changes, poor nutrition, certain medications, and conditions like diabetes.
Smoking seems to come up quite often as a risk factor. How does it specifically affect gum health?
Smoking is one of the most significant risk factors. Tobacco use can make it up to 20 times more likely for someone to develop periodontitis compared to non-smokers. Additionally, smoking reduces the chances of successfully treating gum disease.
Interesting. And you mentioned that hormonal changes can also be a factor. Can you give us more details?
Absolutely. Hormonal changes, such as those occurring during pregnancy, menstruation, puberty, and menopause, can all make gums more sensitive and prone to gingivitis. For example, a significant number of pregnant women, between 60 to 75%, develop gingivitis during pregnancy.
It sounds like there are many potential warning signs. How can someone tell if they have gingivitis?
Gingivitis sometimes doesn't present obvious symptoms, so regular dental checkups are crucial. However, some warning signs include red, swollen gums, bleeding while brushing or flossing, and persistent bad breath.
That makes sense. If someone suspects they might have gingivitis, what should they do?
The first step is to visit a dentist for a professional evaluation and cleaning. Removing plaque and tartar buildup can reverse gingivitis. Afterwards, maintaining good oral hygiene at home by brushing twice daily and flossing once daily is essential.
When it comes to treating it at home, are there any specific practices you recommend?
Definitely. In addition to brushing and flossing, using mouthwash and massaging the gums to increase blood flow can be helpful. But remember, these are supplementary actions. The primary treatment should always be a professional one if gingivitis is detected.
Prevention seems to be a big part of this. What can people do to prevent gingivitis from developing in the first place?
Prevention is all about consistent oral hygiene. Brush your teeth twice daily, floss at least once a day, replace your toothbrush every few months, consider using an electric toothbrush, and visit your dentist for cleanings every 6 months. Also, avoid smoking or using tobacco products.
Sounds like good advice. As we wrap up, what's the one key takeaway you'd like our listeners to remember about gingivitis?
The main thing to remember is that gingivitis is preventable and reversible if caught early. Maintaining good oral hygiene and regular dental checkups are your best defenses against gum disease.
Great advice, Jake. Thanks for shedding light on such an important topic today.
My pleasure, Sarah. Thanks for having me on the show.
And thank you to our listeners for tuning into NewMouth's podcast. Remember to take care of your oral health, and we'll see you next time. That's all for today on NewMouth's podcast. I'm Sarah, and it's been a pleasure sharing with you. Always remember, the foundation of a great day starts with a smile. Join us again next week for more enlightening discussions. Until then, keep those smiles radiant.